Sally, tell me, in your experience as the member for Camden, what are the biggest challenges women in your community face when trying to access health and support services?
I think the biggest challenge for women in Camden is that for so long we have been the country town next to Campbelltown. And so we've always travelled to Campbelltown for pretty much all health services apart from Camden Hospital. But what that's meant is that now that we're expanding and we're getting a bigger population, and I saw some projected figures the other day that by 2040, I think it is, Camden's expected to be larger than Campbelltown. We haven't seen the transition for those services to come over to Camden. So we're still having to travel and to access those services. But also, let's talk about the elephant in the room, that we haven't had access to women's services anywhere. That women really have been forgotten in health, especially in health research, for a really long time. And so the idea that women need bespoke women health services and need bespoke research on women's health is something that I think is just a general problem, but then refined to the fact that in Camden, not only have we had to travel traditionally, but Camden has long had a user pays idea of healthcare. And so if you can't afford to have, or you don't have private health insurance, having access to those facilities can be really challenging.
Thank you. Camden is sometimes grouped with Campbelltown in terms of services and resources. Do you think women in Camden have equitable access to the services do they need, or are there gaps that need to be addressed?
Oh, there are so many gaps. But the problem, I think, too, is that because we are linked with Campbelltown, it becomes a data problem. So all of our data is collected in Campbelltown, and it can be really hard to extrapolate out, are people from Camden, are they from Campbelltown, where are they in that data? And so I think there are gaps, and I think we're starting to see those gaps being filled slowly but surely. But I think it's a data problem that has existed for some time. And it's now talking about extrapolating kind of that data out and separating it out and saying, well, yes, we do think regionally. So the Macarthur region is proud of our region, and we think regionally, we act regionally. But it's also having that conversation of our needs, because one of the things that Camden has gone through as well is a complete revival when it comes to the average age, the number of young people in the area. So the average age in Camden has completely dropped at like a stone. The average age in the Camden LGA now is 33. That's a lot of young women and a lot of children. The largest demographic is 0 to 5-year-olds. And so I think traditionally when we think of Camden healthcare, we're thinking of aged care. But really the reality is now we need to be thinking paediatrics. And I know Southwest Sydney Health, for example, are pivoting really quickly into that and really bringing Campbelltown Hospital into a really strong paediatric position. But what about their mums? What about the women's health care associated with childbirth and child rearing and breastfeeding and all of those services, and making sure that we have access to all of that as well?
100%. And the mental health that goes along with it.
And the mental health that goes with it.
Yeah. Thank you. At the agency exchange event, you spoke about women coming to your office at the worst moments of their lives, not knowing where to turn. Can you tell us more about what you were seeing and why women are coming to your office for help?
Yeah, women, I think there's something to be said about having members of parliament who are women, and having access to, and that is not a comment about the incredible members of parliament we have in the area who are men, but it's not about them. It's about women feeling comfortable talking to women. And I think women coming in and speaking to me about suspected DV. So I sometimes have women come and speak to me about the fact that they're not sure if what they're going through is DV. But also often there is a crisis situation. They leave, they seek the services, and we're really lucky in this area. We have outstanding services available for women escaping DV. They usually come and see me after that. Yeah. They usually come and see me when it's becoming permanent, a permanent situation, that they need help knowing how to move forward as a single mum, as a single woman, saying, okay, how do I then find my way? What support is there for me after the crisis support has stopped? So the crisis support is doing a great job of kind of helping them to this point. And then I think it's the what's next that they're coming to me for. And that's what I'm finding is their point. But honestly, the number of things people come into my office for is so incredibly vast and varied. And I see people who start with, I don't know where else to go. And it can be an incredibly poignant moment. I feel so grateful that people tell me their stories and let me into their lives just for that little time to see if we can help. And sometimes we can't help, and we're honest with that and say, look, we don't know, or sometimes we don't even know if we can help, but we'll try. But I feel so grateful that for that time, people are letting me into their lives and telling me their stories.
Absolutely, absolutely. And that whole idea of surviving to thrive, right? Where women, there is a life after a domestic and family violence crisis. People have to rebuild their lives. Yep. They have to be re-employed. They need long-term housing.
That's right.
And and often it is just having the right advice at the right moments which makes such a big difference.
That's exactly right. And knowing, one of the things I think that we can do really well and really easily is put individuals in contact with the professionals they need, or put them in contact with the not-for-profit groups that they need to help them out in that time. So that's something that I feel like we do rather well, and can say, or we can say to them, the time for that is not yet. Go through the court system, and when that has finished, it's time, then come and see us and we'll set up the next bit.
It's so good. That's wonderful. And I know that Macarthur Women's Health Centre is one of those places that you refer women to.
Yep.
That the long-term community connection that Women's Health Centre has to offer women, it really helps them along those that trajectory for their life.
That's
so
right.
we thank you for that.
Thank you.
When women come to you in crisis, do you think, in your opinion, there are enough options in the region for them to be referred on to?
I think, look, there's never going to be enough. I'm never going to say, we're full, that's it, we've got enough. Because no matter how big a cupboard is, you'll always find ways to fill it. And I think that there's always going to be need. I mean, I dream every day of a world where we don't need any support services and everyone's living in love and harmony and compassion and grace. But that's never going to be the case, and we always need more services, and the ways that people are supported in those situations are so nuanced. And I think that's what can be lost in the wash, is that if we aren't careful, we can try for a one-size-fits-all approach. And even now they don't say one size fits all, they say one size fits most, because even that doesn't fit anymore. Or not anymore, it never did. People are really nuanced and need love and compassion and a tailored approach. So no, there's never going to be enough services, and there's never going to be enough people in those services to provide everything for everyone. And there are going to be women who fall through the cracks, who don't get all of their needs supported. That's just the nature of the beast, I think. And I think that we are all doing our best to provide the support that will help the most number of people. But it's that nuance that can be captured by services such as this.
Mm-hmm. Thank you for that. I wanted to ask you, how do you think local organisations like Macarthur Women's Health Centre can better reach women in Camden who might not know we exist?
That's the $64,000 question, isn't it? It's extremely difficult for anyone, in the modern world to tap into that algorithm of knowledge. I think it's really tricky, and I think it's having access to the other services and each of the services speaking to each other so that there is cross-pollination between services, because that way, if a woman in need knows of one service, she knows of the network. And so I think there's strength in that network, in the network knowing each other, in the network understanding what each other provides. Because then if that woman reaches one person, she reaches them all. And I think that's what we're aiming for.
That's all that networking and knowing what's out there in the community. I wanted to say the women of Camden are lucky to have you as the local member. I really do. Listening to what you say and the vision that you have and the deep understanding of what women will go through is quite significant. I wanted to ask you, what do you think the role of members of parliament, what role can they play in connecting women with community health and social services?
I see myself as the ultimate top of a flowchart. A woman comes into my office and we have access to all of the information for the area, and so we can provide them. And I'm not kidding myself, we don't know everything at all. And so if there are services out there that would like us to have a stronger relationship, please reach out, because we have women who walk in and say, I don't know where else to go, and we say, it's okay, we do. And then to be able to give them the vast majority of what's out there. But also we have access to the information of what the government can help them with as well. So, that's all publicly available. It's not a secret, but knowing where to find that information can be very powerful. And so being able to say to women, at this time, we can make this phone call and help you in this way, can be very, very powerful. I also think, though, there's something to be said for the fact that, like this space, we try and create a very calm, welcoming, relaxing space where I'm at Narellan Town Centre. It can be very overwhelming. And I often say to women, especially with those with young babies, if you need to feed and you need somewhere quiet to come sit in my foyer. It's extremely quiet, and it's separate, and you can come and sit down and feed your baby. We'll give you a glass of water, a cup of tea, and then you can go back to your day. But it's just a little oasis of calm in the middle of the chaos, of a major shopping centre. But just that idea that we have information, we're like an information hub. And we may not be able to fix it ourselves, but if we can't, we probably know who to go to.
And that's exactly what we would hope, that women in Camden will know more about our services, so we are accessible and women get the support that they need. Because women walk in, and we really pride ourselves in providing a women's only space, and we want everyone all women in all of Macarthur to be able to access us.
I think it's really important to point out too, there's been some shade thrown about women's only services and about the need for men to also have services. And I don't disparage men need services at all. But traditionally, for hundreds of years, women have found it very challenging to access honest information about women's issues. And I'll give you an example. So I'm at the age where I'm looking down the barrel of perimenopause and menopause over the next...
Well, the exciting...
Oh, I can't wait. But one of the things I find really interesting is that I've done a fair amount of research, not a lot, not heaps, I'll be honest. I'm not a big sort of deep diver of medical research. But one of the things I discovered the other day is there is a process through menopause that I did not know happened. And I find that shocking, that a well-read, English-speaking woman in her 50s soon cannot have access to all of the information about something that is going to happen to her body. It's not a bad thing. It's not something that I intend to discuss, but it's not a bad thing. It's
challenging.
It's a challenge. And I find it amazing that in 2026, we still do not have all the information about menopause. That blows my mind that we still are like, well, I mean, it could be like that. It's like, it's 2026. How are we still having this conversation? And so I think when you come under the banner of that, not to mention that in many women's lives, there have been horrific things done to them by men. Of course, not all men, of course. But to bring that woman to a place of trust involves women only at the beginning. Then they'll get to a point where they can go and see a male doctor if they need to, but it has to start with women. And I think there's a very powerful narrative being told at the moment that a women's only service or a women's only movement is denigrating to men. And I think, no. It's just lifting us up to where we haven't been before. So I just wanted to make that point because I think it's a really important one to make.
Well, it's really looking at gaps and what the system's failing women, and not being able to disclose some of the traumas that they've had in their lives.
And I'm going to be honest, I'm not comfortable discussing some of the inner workings of my body with someone who doesn't understand the inner workings of my body. That's just a fact. So I think the idea that we feel more comfortable sometimes talking to women about things, I'm sure...
Justified. It's very justified.
And I think men are more comfortable talking about men things to other men sometimes. And I think we just need to acknowledge that and say it out loud and say that's okay. Both of those are okay. They're not mutually exclusive.
Thank you.
Now that you know more about Macarthur Women's Health Centre and the services we offer, how do you see us fitting into the support network for women in Camden?
I can see it fitting in so many different ways. It's fantastic. It's really exciting to know what you do here and the opportunities for women to have access to very tailored, very specific support for them at their need. I mean, there are so many, as I said earlier, there are so many different reasons people come into my office, and to know that we can offer for them to come here and to be seen in a women-friendly environment, I just think is really, really positive.
Thank you. Thank you so much. We think so too.
Spoiler alert.
Is there anything that you would like to say directly to women in Camden who might be watching this interview and wondering whether and where to reach out for help?
Oh my goodness, so much. You're not alone. You're not alone. You are not alone. You don't have to do it by yourself. There are people out there who are just ready to capture you, hold you, hug you if you need it, and help you on your way. So you're not alone. You're not alone with your kids. You're not alone without your kids. You're not alone. You have places. Reach out. My office is at Narellan Town Centre. Come talk to any of the services in our area. They're all in touch with each other. Just please don't suffer alone, and don't think you're causing anyone any fuss or any bother, or that you're too hard or too much. And if you speak to someone and they give you the indication that you are too complex or too much, go see someone else, because there'll be someone that can help you.
Too right. Thank you. Women's health centres across southwest Sydney are working together to demonstrate the collective impact that we are having across Bankstown, Fairfield, Liverpool and Macarthur. How important is it that regional collaboration in helping government understand the needs of women and invest in the right services?
So important. A regional approach is everything, especially when you are in the smaller part of the region. But also I think about the women in my region who may need an interpreter, who may need help with very specific cultural needs. I don't necessarily have access to that specific help, but if they go to Fairfield, if they go to Bankstown, that will be available. So the idea that we're working regionally means we can cover all of that nuance that may not be able to be helped in this service, but may be able to be helped at the nearby service. And I think that's really, really important, because otherwise you end up with little silos that only get knowing to do what they know how to do. And when we're connected, we do have that opportunity to reach out to all those different community groups and all those different nuanced needs that people need.
What health or social issues do you hear about most often from the women in the Camden region?
Oh, that's a really tough question, because I think for me, it would be access to people they trust. A lot of people in Camden are new to the area and they don't know who to go to. They don't know where to go. And they don't know how to create a new relationship with a new GP or a new health service. And so they tend to go back to where they were before. And that's great, that's fine. I'm totally okay with that. Of course, you should go where you're comfortable and talk to people you are comfortable with. But I think sometimes it's aligning you're moving to a new area and having information to, well, where are the GPs in the area? Who has a female doctor that I can go to? But then also going to that service and them saying, oh, we don't have any space. And that can be really challenging. So look, there is a lot of need, and I think the need is changing. And I think because of that, there is so much happening in the area, so much that is changing. And I think for me, the greatest need that's coming to me is that we've had so many new people come to the area and we just don't have the infrastructure. And to be honest, we don't have any of the infrastructure. We don't have the physical infrastructure, we don't have the public transport that we need. We don't have the schools, we don't have the hospitals in the northern part of Camden in particular. But we also don't have the social infrastructure. We don't have the libraries, the community halls, the doctors, the paediatricians, the psychologists. We don't have that is taking its time to come out in the same way that it would anywhere, but it's really greatly needed.
Yeah, the people have arrived before the
That's
services.
right, before the support. So, and we know that there are certain aspects. For example, we're very low on psychs of both types, psychologists and psychiatrists. We're very low on paediatricians, and they're just facts. We are missing the people. So we're trying to grow our own, and that's happening, but there's always a delay, there's always a lag on that, and that's just the way it is.
Well, I think that leads me right into my next question. When you think about meaningful investment in women's health, what would that look like for the communities in Camden?
Oh, again, it feels that sometimes when I first came into this job, it feels a little bit like whack-a-mole. We're looking at a problem and trying to stamp that one out and stamp that one out. I think for me, we've just invested in the most recent budget, the New South Wales government, in frontline DV services. And I'm incredibly proud of that because we're seeing a need and doing something about it. I'm a proud Catholic, and Mary McKillop's a bit of an icon for me, and that's one of her sayings, don't see a need without doing something about it. And for me, that's really, really important that we're seeing this need. And that includes, men's behaviour change programs. It includes frontline services within the whole of New South Wales. And I think seeing how that kind of washes out into our community will be really important, and seeing if there's further investment needed and where we go from there. Because let's be honest, we're not done. We are not finished. We are not doing a victory lap. We are not completed. We have so much more work to do. And I think that having women in prominent places like the Deputy Premier, can really make these conversations easier to have about the need for women to be supported.
Absolutely. If you could change one thing about how women's services are funded or delivered in our region, what would it be?
I will always want more money. I think, in Treasurer. I just think if I could change one thing, I would go back in time and start to fund some of this before we had so much development. I would go back in time and say, hey, just give us a minute. We just have to get this in line first. But that ship has sailed, and I think now we just need to act and react as quickly as we can.
Yeah, follow the population with the services.
That's right. And it won't happen at the speed at which we want it. It never will. But if we can be a little bit comfortable that at least the ship is sailing in the right direction, then I think, we can relax and sort of let it happen.
Absolutely. I mean, this government made an historical investment in women's health in the last election, and you're seeing the benefits of that today with the amount of services that we're able to bring out to Camden.
Amazing.
And so, we're just hoping and praying that continues and that trajectory continues, because the need grows every day. And as you have said, your population is growing constantly, and the age of that population is where these services are.
That's exactly right.
We did a data analysis of occasions of services across southwest Sydney women's health centres, and the coverage for that is Canterbury to Wollondilly. So you could imagine
big size.
the scope. We delivered altogether 92,000 occasions of services over the last 4 years, which tells them when we did a cost analysis, it actually costs less than $50 per woman. What does that tell you about the value of the community women's health centres across the region?
I think it's really important to also underline, out of those 92,000 occasions of service, that doesn't include what the knock-on effect has been to that woman's mother, father, brother, sister, auntie, uncle, children. We're not measuring what hasn't happened. So it's really hard when we're talking about cost analysis that we can't measure the investment in someone that means we're not then paying for them down the road. And what I mean by that is, if you have a woman that comes to a centre and she gets mental health support, she then may not have to need the police, a visit to hospital. Her children might not need therapy later. Her children might not need a hospital visit themselves. Her children may not need tutoring because they've got behind in school. They may not need help when they graduate school because they can't get a job because they're mentally unstable. There is a whole lot of knock-on effects that we can't measure because that woman got that help at that moment. So I think the $50 is probably more like $5 when compared to what we don't spend.
Less than $50.
Less than $50.
It's not even $50. It's less than $50. And that really speaks to some of the stuff that we talk when we talk about women's health. We say women's health centre saves women's lives, saves women's children. But I love how you brought in the whole family.
The whole family.
Family and the benefit of that, because women's health centres are known to keep women out of hospitals, keep women out of the whole that system. So you could imagine the savings the government is saving by funding appropriately and funding adequately women's health centres.
And so I think part of what we're trying to turn the ship on is looking at early investment in people and then trying to extrapolate out what that means we're not spending later. And I was a teacher, so I always think of children first. And I have seen situations where, for example, you might give a mother the early help to recognise that her child needs early intervention for additional needs. Now, that mother does not have space for that if they are at capacity. If they are struggling to get dressed in the morning, they're not going to have the ability, or the capability, I should say, to see that their child needs some additional help. But if we get that child the additional help, they then become a fully functioning member of society, hopefully, later on in life. And so rather than that child being supported for the rest of their life, they're supporting us. They're supporting their mother. So I think it's turning the ship on the idea of investing in people and then letting them come to invest in us, and allowing that sort of conversation rather than it being a true cost-benefit analysis where it's just, what are you worth to me as a dollar value? Because people are not dollars. People are people. And those 92,000 incidences are 92,000 people. And I think it's really, yeah, you're right. It really puts a dollar figure on it that makes you go, for the cost of an electric blanket, I could help a woman at her moment of need. But also, I think it's important to understand that it's not even close to what it costs to our society if we don't. And I think if we don't talk about that, we're really underselling the services that are available.
And I love how you talked about the early intervention stuff, because what some of the stuff that we do really well at Women's Health is that early intervention at all levels, where if a woman, even if you're working with a woman who is going through menopause, or a woman's going through domestic violence, or a woman having parenting issues, all of that stuff really comes in. I love to have used that language. It's our language.
Yeah, right. And I think it's really important to acknowledge life can be hard at any time. At any time it can be hard. So there's no time that you go, well, that was tough, but it's good now. It can be hard at any time. And people can look like they have it all together. And meanwhile, they're slowly falling apart. And I think it's really important too that we have been told throughout society for a really long time, kind of your job is to support everyone around you and make sure they're okay. And no one cares if you're not, because your job is to pull your socks up and make sure the kids get to school on time, and you do this and you do that, and you support your husband, you have dinner on the table. And I was really blessed because I was brought up by a woman who was brought up by a woman that was basically told, you are an individual, you are a human being of value. And so therefore, your job is not to support the people around you. Your job is to fill your bucket and then use your bucket to fill the buckets around you. But if your bucket's not full, you're pouring from an empty bucket, and that's no good to anyone.
And that's very dangerous, and that's exactly what we do at Women's Health Centres across South West Sydney. We fill that bucket every time, and we fill it through the service delivery, through programs, through one-on-one, and I love how it's just not being alone.
Yes.
So she's not alone.
You're not alone.
To come in and feel
and cry.
And cry. And just
you don't have to cry in the shower. You don't have to cry in the shower.
And be you, and only you.
100%, because who hasn't had that moment where you silently cry in the shower, hoping no one will know that you're not okay? And it's really important to say to people, I'm not okay. I'm not okay today. And it might be just today. Oh no, I get quite emotional about this, because if we don't say that to women, if we don't say it to each other, and men, I mean, it's okay, guys. Say it. I'm not doing okay today. And it could be just today. It could be this week.
You don't have to be the pillar, You don't have to be that.
You don't have to hold it together. It's okay to have a moment. And it's okay for it to be a moment. And it's okay to say, I'm just crying in this cup of tea, and at the end of this cup of tea, I'm going to get on with it, because that's how life is sometimes, and sometimes you just need to let it out. And that's okay. Cry. Crying is so healthy for you. I'm a big promoter of crying. And I do it anyway. So.
And I told you that the women of Camden are really lucky to have
thank you so much.
Now, looking ahead, what would stronger partnerships between government, members of parliament and community women's health centre would look like, and what impact could that have for women across Camden and for women across Southwest Sydney?
I think probably the greatest thing we could give to each other, and probably the unattainable goal, would be trust that funding is not going to be lost, that the services will continue, that there's stability in the services. And I unfortunately think, because of the nature of government, it's the one thing that can be eroded extremely quickly. And it makes me really sad that the one thing we both need is the one thing that we can't give each other. And that's consistent service, consistent knowledge, consistent funding, because the needs change and the needs permeate and the different people are making the decisions. And, often the most beautiful systems in the world are ruined by people. But also built up by people. Like it's that thing of, the thing we love the most about what we need is that it's temporary.
That's a very fun and closing question for you, Sally. What gives you hope for the future of women's health in Camden, and what opportunities do you see over the next 5 to 10 years?
What gives me hope? People. The people we have, the community we have. We have the most incredible people. I meet people every day that blow my mind with their compassion and their love and their passion, and people. People give me hope, just generally. And my ideas for the next 5 to 10 years is just watch this space, because we haven't finished growing and we haven't finished figuring out who we are. And I'm super excited about the future of Camden, because I think we're just kind of solidifying where we sit. But I have absolutely no fear that whatever happens will be remarkable because of the people.
Thank you. Sally, one last thing, I always want to talk to politicians about women's health, because we do that quite a bit.
Yeah.
We try to be the advocate to women with who are voiceless sometimes, and some women have a big voice. My dream and my hope before I retire is to have women's health centres as part of public policy. I think we need that, and I would like, we don't have to, you talked about funding and certainty and being consistent. Actually, rather than keep going on about funding and long-term funding and sustainability and contracts and all that, become part of public policy.
And I think it's one thing for us to talk about access to women's health centres, and as we said, this covers the whole Macarthur, the whole Southwest Sydney, which is incredible. But the isolation that rural and regional women feel is unbelievable. And I think if you are a woman in a rural or regional community, you can feel so very alone. And that's where I think it's up to us kind of city folk to reach out and see them. And that's part of our job, is to know that they are alone and that they are scared and that they sometimes feel like they have no one to talk to, and being able to say, we see you too, you're not alone.
Sally, thank you very much.
Thank you.